Okay, well, hey everybody, Dr. Bulow here with Revive Upper Cervical Chiropractic, and this is one of many videos that we do on a weekly basis called Revive Videos. We like to bring you information and research and testimonials and stories, all relating to the importance of the alignment of the spine, the impact that has on your health and your life. And this month we've been talking about Revive brain health, right? How does the spine affect the health and quality of your brain, right? We know that the brain controls and coordinates every tissue and cell in your body, so the health of your brain is fundamentally critical to your overall health and well-being. And a study came out in February of 2019 that kind of links the importance of spinal health to the brain, and in particular, it was done with people who were chronic stroke patients, people who have been dealing with the negative long-term effects of having a stroke. This is a pretty important study, and for a very a group of patients that have a hard time, a hard prognosis coming back from a stroke. A stroke is a lack of blood supply to the brain and can be life-threatening. At its worst, it can kill you, but it can also leave lingering long-term deficits. And in this case, they had patients who all had a problem with plantar flexion, the ability to flex and point the toes down, to flex the foot down and away. And this study was done by a group of doctors down in New Zealand led by Heidi Havoc. Dr. Heidi Havoc is a chiropractor and a researcher who's doing a lot of studies with the brain. How well does the brain respond to spinal adjustments, chiropractic adjustments to the spine? And in this particular study, what they did was they had a dozen patients that were chronic stroke patients, and what they did was they read the amplitude or the drive of the brain when it was asked to perform a task, in this case plantar flexion of the foot. And then they went in and they made these adjustments. They corrected the alignment, they stimulated the nerves, they made chiropractic intervention done in the spine. You know what happened? When you stimulate and correct these misalignments, subluxations of the spine, it actually was shown to increase the amount of cortical drive, right? The brain wakes up, says, oh my gosh, what's going on here? Now I'm more aware of my surroundings. Now when the brain decides to go move a muscle, lo and behold, that increase in cortical drive showed an increase in the muscle strength. In this case, in stroke patients that were recovering. So some pretty impressive implications. What it means is that spinal care, properly done chiropractic care, could be an adjunct therapy or way of recovering or enhancing the innate capabilities of the brain so that the body can heal and recover and improve from something as serious as a stroke, right? And it also tells us and reaffirms that the spine plays a critical role in waking up and keeping the brain active and healthy. Something chiropractors have been saying for years is that the spine is a critical choke point between the messages going in and out, to and from the body. And subluxations of the spine, misalignments of the spine, can interfere with the clear communication between the brain and the intelligence of the body and the body itself, right? This is some really important stuff, I think, for anybody who's looking to enhance their brain function, enhance recovery recovery methodologies, and especially if they're dealing with the negative long-term adverse effects of a stroke. So if you have any questions, I'd love to hear what you think about this. The study was called The Effects of a Single Session of Chiropractic Care on Strength, Cortical Drive, and Spinal Excitability in Stroke Patients. It came out February 2019 in Scientific Reports. It can be found on nature.com. If you want to look that up, that's where you'll probably find it. My name is Dr. Bulow. This is Revive Upper Cervical Chiropractic. These are Revive videos. I hope you're doing well. I hope this gives you some inspiration, some information. If you have any questions, let me know. We'll talk to you next time. Bye now.